Hi everyone, welcome back to my YouTube channel KMW Wellness and Lifestyle. If you're a first timer on my channel, I would love you to subscribe to my YouTube channel, then on your notification so you can get informed about subsequent videos I post on my channel. And again, if you are a returning subscriber, I just want to say thank you for for subscribing to my YouTube channel. Thank you so much. So today's video is about premenstrual syndrome, known as PMS. Yeah. So what is premenstrual syndrome? Premenstrual syndrome is the changes in moods, emotions, or physical health or behaviors of women, and it occurs during the period of ovulation and the start of period in women. So that is what PMS is. It's changes in hormones, changes in the mood and then the behavior of women, and it's caused by several factors, which I'll still talk about as the video continues. But PMS it actually affects every woman, but the effect is different in different type of women. Some men, they have this effect very pronounced, in which it affects their day in day out activities, while some other women, the effect is not really that is not really that much in them, so they can still go on with their day in day out activity, while some are totally always affected by this PMS. So if you are a man watching this video, I would love you to stick around and watch it to the end, because you'll be able to have some helpful tips in helping your woman go through this premenstrual syndrome. And also, if you are a woman, I would love you to also stick around and watch it to the end, so you can have some helpful tips, and then helpful tips in coping with your premenstrual syndrome. Also, it's season of love. I just hope I can put this video out today, which is the Valentine's Day, but if not, then it should be after Valentine. But yeah, the greatest thing you can offer your woman as a man is care, and then helping her go through difficult situations like this premenstrual syndromes, and menstrual cramps and the like. So stick to this stick with me, and then let's talk about the causes and then effects, and also the useful tips to help support and relieve this premenstrual syndrome. So what are the causes of premenstrual syndrome? The causes of premenstrual syndromes are classified into, or they are divided into four parts, and the first one is cyclical change in hormones. Yeah, cyclical change in hormones. During the time of ovulation and then the start of period in women, the level of estrogen and then progesterone, the level gets to be decreased, though it first attains a level of peakness and then it drops drastically. So this fluctuation in hormone, in the sex hormone, causes irritability and then anxiety in women. So that's one of the major causes of premenstrual syndrome. And also we have the changes in the chemical in the brains. Yeah, so the chemicals in the brain that helps in that helps in the moods and the emotions of everyone, but in this context now of women, is serotonin, acetylcholine and dopamine. But when there is a drop in estrogen level, the brain, it causes the brain to release norepinephrine. Yeah, norepinephrine. And when there is a release of this norepinephrine is also a neurotransmitter. But when there is a release of this norepinephrine, it causes a decrease in the actual mood hormones or mood chemicals, like this serotonin, acetylcholine and then the dopamine. So it causes a decrease in their own production, and then in turns it causes depression, anxiety in women. And also we have mental illness, like underlying mental illness. So when a woman has an underlying mental illness like bipolar disorder or postpartum depression or or they have chronic anxiety and all of it, it makes the symptoms of premenstrual syndrome more pronounced. It makes it more, more aggravated and all of it. So and so it causes a greater form of premenstrual syndrome, which is known as PMDD. That's premenstrual dysphoric disorder. So it's just a greater form of premenstrual syndrome, because the anxiety becomes more, more pronounced. The depression becomes more pronounced, and then there will be panic attacks, feeling depressed, outburst of tears and cries. So that is that on having an underlying mental illness. Also, one of the causes of premenstrual syndrome is lifestyle factors. Yeah, lifestyle factors. So when a woman engages in smoking heavily, or drinking a lot, or eating foods high in fat, sugar, and then salt. Yeah, eating food high in fat, sugar, and salt, they all causes premenstrual syndrome, or having or not having adequate sleep of like between 7 to 9 hours at night, not having enough sleep, or not having physical activity, not doing exercises. So all this type of lifestyle affects premenstrual syndrome. It causes premenstrual syndromes. So yeah, so now that we know the causes of premenstrual syndromes, let's talk about the effects of this premenstrual syndrome. So the effect of premenstrual syndromes can be classified into two, which are emotional symptoms and then the physical symptoms. So the emotional symptoms are anxiety, anxiety, irritability, depression. When you're having depression, and when you're having high appetite for for sweet things. Yeah. So when you're having high appetite for sweet things, that is not the time for you to now start eating chocolate, eating junks, and very very sweet things. It's just for you to know that I'm having PMS already. Then just cut your intake of sugar or salt or the likes, because at the long run, your excessive use of sweets, or your excessive eating of sweet things causes your PMS to be to be aggravated. So we also have some of the emotional symptoms of PMS as decreased in sex drive, uh yeah, low mood, and then outburst of cries and all of that. So they are all symptoms of emotional symptoms of PMS. And also we have the physical symptoms of PMS. This is the symptoms that you would also notice as a man, that oh, my partner is having these symptoms, then she's probably going through PMS on already. And then don't forget, you know that the PMS is between the period of ovulation and the start of our period, which is actually roughly between the 15th day of our menstrual cycle to the start of our period. So the physical symptoms of PMS are they are like stomach cramp, constipation, soreness or tenderness of the breast, headaches, yeah, muscle and then muscle pain, back pains, yeah, back pains. She'll be having all of those physical symptoms of PMS, and then she might be having constipation as well. So those are the critical symptoms of PMS. So now that we know, okay, you know these symptoms that that you should look out for in your woman. Let's talk about the helpful tips that that you can just acquaint yourself with, so that you can help your woman go through this difficult situation. The tips to helping is the symptoms of premenstrual syndromes. So the tips are: first, eating a balanced diet. So ensure you are eating, foods that are high in fruits and vegetables, fruits, vegetables, and then whole grains, and also, you know, cutting back on the eating of foods high in fat, sugar, or cutting back on the use of caffeine, of is taking caffeinated drink, cut back in, the amount of caffeinated drink you eat. We've also talked about caffeinated drink causing stress. So most of the time, stress is also linked to this menstrual syndrome, and also reduce the intake of alcohol. Yeah, so so you can have so you can be able to ease the symptoms of this premenstrual syndrome, and also taking plenty of fluids. Yeah, so take fluids a lot, and also probably water, or if you are going to take herbal teas like raspberry tea leaf, or chamomile leaf also. So these are like herbal teas that you can use to help reduce stomach cramping. Yeah. So, and also you can talk to your healthcare provider or healthcare professional about the intake of supplements like folic acid, vitamin B6, calcium, and magnesium. So yeah, you can talk to them, so they can advise you based on your normal body system, if those supplements are good for your body, because those supplements actually help, they help in easing cramps, and also in improving one's mood. So talk to your healthcare professional. Also try as much as possible uh to get natural vitamin D from the natural light, or trying to or get it from foods or supplements. So get your vitamin D also, and also get a regular sleep. Sleep very well, within like 7 to 9 hours of sleep at night is a very good one. And then regular exercise. Ensure you're having a regular exercise at least in a day. Just take an hour of exercise is okay. That involves vigorous activity like jogging or treadmilling or aerobic. So just start with to do like exercises that will help in improving your mood, and then helping you to manage your stress or manage your cramp. Yeah. But exercises are always have been studied to help in easing stomach cramp. Yeah, and also we have self care. Yeah, do a lot of self care like massage, cryotherapy, uh, taking your bath regularly, or brushing your teeth, going out, eating out, meeting with friends and family. So those are the exercises that these are like self care things you can do for yourself. And also we have medication. You have medications you can take over the counter, or by talking to your doctor. We have pain relievers like ibuprofen, aspirin, or yeah. So just try and talk to your doctor about those drugs. Most of the time, they can get it over the counter, and it has minimal side effects. So you can take them at any time you feel like you're having muscle or body pain. And also diuretics help in the soreness and tenderness of your breast. So tap your friend to take diuretics. And also the soreness and tenderness of the breast. It has been studied that ladies that have enough sucking of their breast before the period of ovulation tends to have minimal soreness and tenderness of their breast. Yes, so as a guy, you suck your woman's breast and all of this, so she can have minimal soreness and tenderness of her breast. Upper, yeah, upper. So, and also we have heat wraps and heat pads. Yeah, you can get that over the counter or at pharmacies. So those heat pads and heat wraps are placed on your stomach to help to ease cramps. Yeah, so it's to help to ease cramps. So those are the helpful tips, for you to uh, ease the effects or the symptoms of the menstrual syndrome. So don't forget, eating balanced diet, regular exercise, taking supplements, taking a lot of fluids like herbal tea, so that you can ease your cramp and all of it. And also self care, having taking going out to take natural vitamin D, or eating foods that high in vitamin D, and all of them. Also cutting back in the use of carbonated drinks or foods high in salt, sugar, and alcohol, cutting back in those things, and self care also, and pain reliever and all everything. So those are the helpful tips for easing your premenstrual syndrome. So thank you very much for watching today's YouTube video. I believe you've learned one or two things from this video. As a man, you can use that to help your woman that is going through premenstrual syndrome, and also as a woman, you can use to help yourself by taking making use of those tips to help relieve your symptoms of premenstrual syndrome. Yeah, so if you know you've learned one or two things, and then you love to gain more informations in subsequent videos about wellness and lifestyle, so hit the subscribe button and then turn on your notifications so you can get subsequent videos. So you can be notified of subsequent videos. And then also, I would love you to also like just to comment, say something about the video. You can also say you subscribe so other people can also subscribe to my YouTube channel. So thank you very much for sticking with me today. I remain your humble person and your favorite YouTuber. Bye. Thank you.